Welcome to the Doctor Connect Show, the home for open conversations where top experts share their experiences and empower you with transformative education around cancer, health, wellness, and medical technology. I'm your host, Dr. Ludmila Schaefer, medical oncologist. And if you are looking for a better health, global partnership, and want to make a social impact, you've come to the right place. From sacrifice to a celebration, and the answers on how to turn your life around. I'm super pleased to announce that my podcast getting a lot of traction because you, my audience, provided such a great support. So thank you for your time and interest. I'm so excited to be bringing my years of experience as a medical oncologist to the podcast and television world. Listen, watch, give a rating, and subscribe so you never miss an episode. And if you like our show, subscribe and comment what you like about the show. And go to the website, thedoctorconnect.org, and click the button, submit the question. You can either submit your question, or if you want to share your medical journey or health wellness story, simply type, I want to share, and we will reach out to you. And if you are in healthcare, spread your expertise or passion globally, you schedule a consultation, National Impact Strategy. Whether you're a clinician, researcher, entrepreneur, mentor working in industry, leadership, or coaching, my program teaches you how to spread awareness of your expertise. For the past couple of years, there has been a fundamental changes in healthcare delivery, expensive medication, long wait at the doctor's offices, and I'm so thrilled because I'm joined today by a very special guest, Dr. Laura Fortner. She is a board-certified OBGYN and the founder of the MedMal Coach industry and consulting service. She is an author and speaker and has been featured in Authority magazine, How to Improve U.S. Healthcare System. So stay with us till the end of the episode because you will learn a lot of practical and evidence-based information. Dr. Fortner, welcome. Thank you for joining us today.
Thank you for having me. It's an honor.
So you are OBGYN and I'm an oncologist, and I know that the patients have just such a huge bill. And since today we're discussing all barriers, and we really want to understand how does it work? Why patients end up with such huge bill? For example, the other day I read an article and someone delivered the baby, was healthy, the baby was healthy, they discharged pretty much the next day and still end up over $30,000 bill. Can you tell us a little bit why this is happening?
Yeah, medical costs and billing these days is a very complicated issue. 60 to 90% of physicians report that they play defensive medicine. What is defensive medicine? Well, it's when they overtest, ordering tests. And really they're doing this because they don't want to miss a diagnosis and their fear of litigation, which is really getting sued by medical malpractice.
So if I'm a patient and listening today and thinking, what do you mean by missing diagnosis? Does it mean that the doctors don't know what they are doing?
Oh gosh, no. What it means is we're over testing. We're doing more than really we need to do at a clinical visit because of these issues with getting sued and the fear of missing something.
And we hear this all the time that the patients say, you order all this tests and now I have this, thousands of dollars medical bill. And then they think, the reason you are ordering So you actually make money and you become richer. Sometimes I walk in a room and they say that, oh, here is the rich doctor, but this is not reality.
The physicians are not getting the money. Let's be clear. They're really doing it to take the best care of that patient during that visit. And they come up with the testing that needs to be done based on patient's symptoms and where they are. And yes, a few more tests may be run than maybe in the past because of this issue of possible impending getting sued. And so I think that this is one of the things that we could really improve in healthcare right now. I mean, it is estimated that we spend about $50 billion in the US because of the overtesting.
And where this money actually going? How can we explain to the community that that's actually not physicians getting in the pocket?
Yeah, the money's actually going to the insurance companies, to all the other ancillary, the businesses part of it, which is the hospital network. Most physicians are employed. They get a salary. So none of the things that they're ordering comes directly back into their pocket. Working on the patient-physician relationship to build trust is essential.
And how do we build trust? How do we actually develop this trust if physicians need to order so many tests and then patients also, feel that they get in high bill? I know patients, they are losing homes, they move in with their children, they losing cars, so many things happening. So how can we develop this relationship? What can we do?
Yeah, there's many things we can do, but I think one of the first things is to really understand common humanity. What do I mean by this? I mean that, each human is coming together and we're both flawed in many ways. And if we can come with a compassionate heart, kindness, and understand that we're both humans that have flaws, that can go a long way. I think one of the other things we can do is really practicing some mindfulness, which is being present in the room, getting to know each other, building a relationship instead of a number. I think oftentimes patients feel like they're a number in a practice, and we've got to come at it in a different way.
And, speak from the patient perspective. If I am in the room with the doctor, of course, I need to make sure my diagnosis is correct. I must make sure my treatment is the best. So because when the patients also see there is a minor thing, it comes second opinion. After second opinion, it's more money. And then third opinion, there is need to be involved more money. And then after they actually see the visit, then they spend higher cost. And then many times they find out that opinion actually the same, because many physicians practicing the same. It's just some institutions offer more fancy test or more fancy equipment or maybe more beautiful chair. And this is really almost degradation. Can you tell us that also if we step from the actual exam room down to the waiting room, and can you explain us what's happening there?
Yeah. So lots of times patients come in and they wait, right? They wait for their doctor and they wait and they wait. And it can be very frustrating in the waiting room. There's actually something called waiting room anxiety. And the longer that you wait, the more that's apparent where patients feel a little anxious. So one of the things that I love to do, and I work with my physician clients on this because I think it's really helpful, is you can do a mini meditation anywhere you're at. And this is so great to do it in the waiting room to provide calmness and de-stress yourself. So what I like to do is say, if you're sitting there, you can even keep your eyes open. You can sort of say these things to yourself and breathe in and breathe out. And I'm going to teach you how to do this now. So basically, when you breathe in, you can say, I accept what is currently. And then when you breathe out, you're going to say, I release all resistance to it.
So that's actually very powerful. And so this is from the patient perspective, but what doctors can do or what the medical staff can do.
Before the doctor actually even walks in the room, one of the greatest things they can do is really, center themselves, get to a positive place and a compassionate place for this patient and walk in with listening ears. The best thing we can do is listen more and let the patient get the frustrations out. Really have that open communication to build that trust.
At some point, I practice in my life when in 15-minute interval, we're scheduled 2 or 3 patients. So honestly, Dr. Fortner, I don't have time to spend that much time. And then patients think that, okay, we doctors treat as a cookie cutter or maybe walk for 5 minutes. But how can we overcome these barriers? Why this is happening?
Yeah. Well, I think one of the best things that we could do is we can be open and honest with the communication with the patient. I think this is where we go wrong. We go in harried and we try to get things rushed, and it can be just as effective to go in and say, gosh, I am so sorry that you've waited for so long. I know you must be frustrated. Give them a compassionate ear, share with them, be honest.
As you are providing so many tools for the patients, and I feel like you are a huge patient advocate, but also I search a lot about you, and I found out that you are actually coaching physicians, and it kind of struck me, you stand as a patient advocate, but you actually teaching and coaching physicians. Can you tell us a little bit, what do you do? How physicians can actually lean toward you? You can be as an example.
My journey is that I really help physicians go through adverse events and medical malpractice. This is something that something called litigation stress, which is a stress that we physicians go through when getting sued. And so I help them navigate that. But why I'm such a patient advocate is, my journey has really identified the way we could avoid some of these problems that are in healthcare regarding the physician, which is litigation stress is one of them, is we could really advocating for that patient-physician relationship and being better at it. We're not, I don't think, good at it in some sense to where we're able to prevent some of these cases. I mean, the number one reason why patients sue physicians is because they weren't open and honest with their communication, and they felt like the physician was hiding something. So it's so crucial to really work on this relationship.
And I don't know any physician out there that actually the patient would not complain. And if they say that they practice for 30, 40 years and they've never received a patient complaint, I think there is a huge problem with the physician. So I think every single physician had some situation or some miscommunication, but all of us go through extensive training. I mean, it takes close to 13 and some specialties even 14, 16 years become a subspecialist. And then the longer you study, the longer you work, the more you sacrifice your family, children, eating, sleeping, even simple things like not being able to go to the bathroom because you are in the OR, seeing patients on call, post-call. This is really, and then the more education you are getting, actually the higher level is the lawsuit.
Yeah, it's so true, Ludmila. Like, I feel like this is such the physician perspective, right? And when a physician gets sued, it crushes them because we are, and who we believe to be, these caretakers that have done so much for people. And then when this happens, it really creates such a deep emotional injury. It's hard for us to get past it. And the joy of medicine gets sucked out of us. We feel like maybe we should quit medicine at this time, all these emotions. And what I believe, there's no resources out there for physicians when these things happen to them. And this is what I'm doing. This is something that needs to be done for our healthcare community and to really up-level physician communication as well. This will help everyone.
What is it that you teach about myth versus facts? Isn't it everything in medicine is facts? I mean, this is not even possible to have a myth in the healthcare.
Yeah, so this is such a great thing. There are facts, and facts would be things in the chart, things that, you and I would agree on in a courtroom, or like someone said to you, that's a fact, right? So those are facts. But here's what happens with the human brain is it likes to lie. It likes to embellish. It likes to catastrophize. And we create stories around the facts. And when we do that, it makes us feel worse, right? Or better, depending on the story that you choose to say.
But then also, because the physicians actually also see patients, and it's really difficult when you have a patient in the room, but and then also all phone calls, and not considering that we have to speak with consultant and your high-level specialist. So that phone call, when the patient receive and the level of anxiety goes up. So why we have this barrier in the healthcare?
Yeah, it's just what has been happening with healthcare in terms of, the business of healthcare. I just want to point this out because, the corporations that most physicians are employed by, or the hospitals, there are steps to be taken to get to that physician, and physicians have patients 1 to 2 every 15 minutes, really hard to get back and forth with that. But and the patient just sees, I can't get a hold of anybody, right? I mean, they get put on hold. They're, the nurse is supposed to call them back and then doesn't call them back. And so this can be super frustrating. I think, again, one of the things that patients can really do is step back and really look at the facts of what is going on, and then sort of the story that you're telling yourself about this. Instead of saying, this doctor and their office is, terrible or whatever, maybe look at it from a different storyline. Like, gosh, they must have a lot of patients today. I'm going to leave a message, and I'm going to keep leaving a message, right? I do think this is one of the things that the healthcare system does need to work on. It is a barrier for patients, and it's a barrier for physicians, because a lot of times, sometimes the physicians don't even know the calls that are coming in at the front desk. And so systems need to be developed in offices as well to be better able to handle this kind of barrier. There are several tools that I teach, and there are several things that we work on through the process of going from, sort of overwhelm, even burnout, or not, the joy has been gone from you because of what you're going through, to feeling peace of mind, having that confidence back again, and joy back again.
If we do not sort of take each of us step forward, we actually could have a shortage of physicians, and then who patients is going to see if we're not able to balance this?
Yeah, research does show there's going to be a huge physician shortage, I think even as early as 2025. And what I am seeing with the physicians that I'm working with, almost every single one of my clients are coming to me saying they want to quit medicine. And it is because of these barriers and these things that are happening.
So there is, if we look right now at the healthcare system, and if we don't fix these barriers with the all physician shortage, then who patients are going to see if we're going to have a physician shortage?
Yeah, I know. Well, there's not going to be any healthcare. If there's no physicians, there's no healthcare. And really recognizing that the healthcare workers, especially physicians, need to feel valued. They need to feel appreciated, but they also need to be in partnership to up-level themselves to a whole new level by working on, how they're thinking and their thoughts, and how to go from a state of overwhelm, which is caused by the stories that we tell ourselves, to going to back to joy of medicine, taking care of patients, loving what we do. And this is really inner work.
And some physicians practicing for a long period of time, and they don't even realize themselves that they have burned out. They don't really think that, there is a problem, and they keep going. And we physicians, we're supposed to show no emotions. We're supposed to work. And I have an experience over 26 years. I was under training when we work over 35 hours.
Yeah. And you don't want, patients, you don't want to see somebody that has been on call for days because they're tired, they're ragged. The culture of medicine really perpetuates this idea of sacrifice, of not sleeping, of giving it our all and pushing and repressing our emotions. And so we're taught this from a very young age when we get into medicine. And so it's very hard for us when something happens, an adverse event, or maybe we have a medical malpractice lawsuit. And when this stuff happens, we don't know how to even manage our emotions. We don't know how to think differently because we've been trained for so many years through the culture of medicine that we have to push down, repress, avoid emotion. And that's not healing. Healing and getting through this and beyond the other side, to not want to quit medicine, is actually to feel the feelings. It's actually to not repress them. And it's actually to start giving yourself self-compassion and self-care. Physicians need to learn to take care of themselves inwardly. And this is not something we know how to do. And this is what I teach.
This is such a valuable point, because going back in March, I believe, when there was matching. And for those who don't know what's match, it's when physicians, when medical students getting into next level of training called residency, and then some physicians choose to be subspecialists. So it's a next level of training for doctors called fellowship. So when young medical students getting in, and I've seen some video and right now on a social platform share, I got matched, I got into this. So they go into residency or fellowship, and then they become attendings. They're so happy, and then boom, burnout happen. So that's where exactly we are trying to fix problem early on, and maybe even incorporate this into medical schools sort of early on, to have this understanding and communication. To me, it seems like this layer that no one talks about it. You just have to see patients, pass the curriculum, make sure you have a passing or appropriate grade. But there is some layer, there is some almost like, things that not communicated. Do you think that would be helpful also for younger doctors reaching out to you?
Absolutely. And in fact, I just spoke with some OBGYN residents over this past week, recognizing that they don't know. Again, we don't learn this brain science in medical school or our training. And I think this is so crucial to learn how to manage our emotions, how to feel things, how to come from a compassionate place, even when things around you, circumstances around you may not be the best. And understanding, like with what I do in my work, understanding the percentages that medical malpractice and getting sued as a physician is normal. In fact, 99% of physicians in high-risk specialties will be sued. And then how to prepare for that if that happens for that physician, and really giving them the knowledge ahead of time and resources ahead of time. Because what happens is these things happen to us, and then we don't even know how to handle it or where to go, and it paralyzes us.
So how physicians can reach out to you and learn those tools from you?
Yes, all they have to do is go to the MedMalCoach.com, and they can contact me there. They can also contact me through my email, the MedMalCoach@gmail.com. as well. So that's how they can find me. And yes, we all need to learn. I feel like this can escalate and really reform healthcare by learning these tools early on. And, and the one thing I want to say too, before we end, is I do believe there needs to be tort reform in the United States. And this is for physicians. This is something that is needed right now. State to states make their own rules depending on medical malpractice. So wherever you live depends on what rules you follow in terms of that. And we all have, we all get board certified by the American Society of our specialty. And so we all should have the same rules regarding when we get sued as well. And I really believe this to my whole heart, that there has to be some sort of tort reform to really help to help the physician feel safe and secure that they can practice medicine to their best of their abilities, as well as for the patients. This will up-level the patient scenario and the accessibility that the patient has to the physician, and the trust that will be developed between patient and physician can just up-level everything and change our healthcare.
Wow, Dr. Fortner, thank you so much. This has been such a valuable interview. And when I got on interview, really, I didn't even know what to expect, because this is a very sensitive topic for physicians, and for patients. It seems like it's almost a complete disconnect in the community. And yes, everyone wants to have a better health, taking care of themselves, have a great lifestyle. So thank you so much. And I urge everyone, all physicians in training or practice, please reach out to Dr. Fortner. Dr. Fortner, thank you so much. It has been pleasure having you. Thank you.
Thanks so much, Dr. Schaefer. I really appreciate it.
Thank you for being with us on the Dr. Connect show. Do you have a question, an idea, or a topic? Would you like to share your experience or expertise? Go to the website, thedoctorconnect.org, and don't forget to follow on the social media and join and subscribe my YouTube channel, The Dr. Connect. We are so super excited to have you on this journey with us. Thank you for watching and listening, and we are looking forward to seeing you in the next one.